Type 2 diabetes is a progressive condition. If we leave type 2 diabetes uncontrolled, it can progress, sometimes slowly, sometimes rapidly, and it can affect various organ systems of the body. So the typical complications of type 2 diabetes that are linked to the kidney, heart, our feet, our eyes, our liver, and now even our bones. So it's very important that we try and halt diabetes. So if you stop diabetes progression, you can save all these organs from getting affected by type 2 diabetes. What can you do to halt progression of diabetes? You can follow a good lifestyle, which means diet and exercise, ensure stress reduction, proper sleep, which is easier said than done sometimes. Certainly, if you're overweight, which most people with type 2 diabetes are, weight reduction becomes an important part of your preventive strategy. Try and make sure that you're taking your medication regularly, talk to your doctor, and very importantly, must check your blood glucose and other parameters as advised and follow up at periodic intervals with your doctor. Do not make the mistake of not doing anything because you're feeling fine. Because blood glucose per se may not produce any symptoms, and symptoms may happen only when complications have set in, by which time it may be quite late. So if you follow these basic principles, you can control your diabetes and halt the progression and save your organs. Along with lifestyle, medications play a very important role in our battle against diabetes. Remember always, you fight your malady, don't fight your medication. Medications are our tools to help fight diabetes. Of course, older medications typically controlled blood glucose, and by controlling glucose, they were able to reduce the risk of complications. Newer medications have gone further. They not only help in controlling glucose, they also help in protecting our organs, especially kidney, heart, liver. So many organs can be protected by these medications independent of their effects on blood glucose. So they are also reducing the risk of complications. But there's one additional thing. And as we said, losing weight is one of the most important ways to reduce progression of diabetes. We are looking at diabetes, we are looking at truly reducing complications and doing that right from the beginning so that the progression of disease itself is halted. One important point that is often missed out in this is weight management, because it's very, very clear that both in terms of preventing the development of diabetes or preventing the progression of diabetes, and of course I'm talking of type 2 diabetes here, weight plays a critical role. So weight loss in people with type 2 diabetes is a very effective strategy to help reduce progression of disease. And this is something that is often neglected. People just look at their blood sugar, their cholesterol, their blood pressure, and they forget that for long-term benefit, one must try and lose weight. That is one of the cardinal ways in which we can reduce long-term complications, reduce progression of disease, preserve a little bit our pancreas, improve our insulin resistance. One of the most frequently asked questions of me these days is, can diabetes be reversed? We prefer to use the word remission because reversal implies permanence, whereas remission could be temporary or permanent, we don't know. Yes, it is possible in some people, especially in the early years of their disease, especially if they are young and overweight, that if they lose body weight, they can possibly achieve remission of their diabetes, which means they can remain without medication in the non-diabetic zone of blood sugar for months or years or longer. You will lose weight in the initial phases and then your sugars might normalize and you may not require medication. So diabetes remission is possible, not for everybody, but if used carefully, if patients are compliant and following advice, it is possible to achieve diabetes remission in a significant number of cases.